Hi, I'm Sable Knight. This is a letter that I wrote to my representative, Dr. Kim Schrier, in the Senate, and I really care about this issue, so I also felt like making a recording of the letter in its entirety. To Honorable Dr. Kim Schrier, Dear Dr. Schrier, hello, my name is Sable Knight, and I'm a resident of King County, Washington, writing to you specifically on account of your medical expertise and advocacy. My request is for your office to introduce a federal bill which bans non-urgent penile circumcisions, only allowing the surgery in cases where it is medically necessary or elected by the individual being operated upon. As someone who was circumcised as a baby for aesthetic reasons and found out only as a young teen, it's incredibly important to me to protect the bodily autonomy of people with penises and prevent my case from happening to anyone else coming into this world. While I believe this is something which should be decided entirely on the basis of bodily autonomy, many will argue that circumcision has a long-term medical purpose. While there is evidence that circumcision reduces the risk of transmitting STIs, there are other preventive methods which are much safer to rely on, combining robust health education, discussions and testing between partners around known or potential STIs, and of course, direct protection in the form of barriers like condoms and medication like PrEP. If partners are considering sex and know there is a risk of transmitting an STI, they should obviously not rely on circumcision to prevent that transmission. Using a condom or barrier offers sufficient protection for both circumcised and uncircumcised individuals. While there are added complications for adults seeking circumcision, it is still an option for many of them if they desire that extra level of protection against STIs. And health education should inform them of those potential benefits, as well as risks and changes resulting from the procedure. Superseding potential medical benefits of this procedure, though, this issue comes down to bodily autonomy, which I know you fight for in the case of reproductive care. While parents may make many important and often beneficial choices for their children, few are so instant, long-lasting, broadly affecting, and irreversible as infant or child circumcision. Foreskin cannot grow back, and circumcision permanently reduces the erogenous function, look, and pleasure of the penis and the person it was attached to. Our skin grows hard, it no longer self-lubricates, and many of us have tight, painful, or unsightly scarring left from the procedure. As a teen, finding out what a foreskin even was, realizing I didn't have one, and coming to learn that my parents chose this for me for aesthetic reasons, so that I wouldn't look weird or be ostracized by sexual partners, was devastating. For years, I have mourned that part of my body was removed to conform to the standards my parents grew up with, which none of my partners have ever cared for, and that the procedure has reduced my sexual pleasure and caused dysphoria in my body. This was a choice that, if legally protected as a baby, I could have made for myself as an adult. Instead, it was permanently taken away from me by the people who unequivocally still love and care for me the most. While this is becoming a less frequent occurrence in our state of Washington, it still happens, and still more people will grow up like I have, learning that this irreversible removal of part of their body was done to them when they were a baby without their consent. A choice which reduces their sexual pleasure and reminds them of this traumatic stripping of agency forever. Our culture still largely accepts and parents making this choice for their children on account of aesthetics, potential but truly marginal health benefits, culture, or religion. But none of these factors should outweigh a person's right to decide how their body is changed, especially when it has irreversible negative outcomes. And so there is a clear need for their right to bodily autonomy to be protected by the law. For this reason, I ask again, please introduce and support a bill which protects the bodily autonomy of Washington residents and people around the country by banning non-urgent penile circumcision. Protect the agency of babies and children who will become adults, whose parents or communities should not be unnecessarily removing a part of their body without their consent. If you consider or introduce such a bill, please reach out so I may also rally friends, family, and others in my community to support it. Thanks again for considering this proposal and for all you do as our Washington State elected representative. Sincerely, Sable Knight, and I use she, her pronouns.